I'm Katie from Rocky Mountain University of Health Professions. So today we are going to use mechanical traction for the lumbar spine on our patient Gloria today. She is a 75-year-old female with a history of lower back pain. She was diagnosed with degenerative disc disease and has been told that she has lumbar spinal stenosis. So some indications that we would use lumbar traction on this patient would be things like muscle spasms, joint hypermobility, degenerative disc disease, which is in this case for our patient, facet joint issues, radicular symptoms, and there's some other things too, but some contraindications that we would look for is things like spinal fusion, spinal implants, fractures, osteoporosis or osteopenia, which we would want to check since she is a female, a little bit older, so she could have some of those things, and acute inflammation or some strains or sprains in the back. So we will talk to our patient and get her set up on the spinal traction. Hi Gloria, I'm Katie. I'm going to be your PT that's working with you today. So I know that you're dealing with some lumbar pain. Can you tell me a little bit about that?
Yeah, I got diagnosed with degenerative disc disease, and I've just been having like a lot of pain in my lower back, and it kind of like radiates down into like my bottom a little bit.
Okay.
And it only kind of helps if I like bend over and kind of like sit down. It hurts especially when I'm like walking and stuff. So.
Okay. Yeah, so today I kind of wanted to try some mechanical traction on your lumbar spine to see if that will just help the pain and the disc disease. But
okay.
Before we do that, I just wanted to make sure that like you don't have any things that will make us not be able to do that. Does that make sense?
Mm-hmm.
Okay, so I just want to make sure you haven't had like any recent fractures in your spine or surgeries or osteoporosis or anything like that?
No, I haven't had any of that.
Okay, so. Perfect. So we should be okay to do the mechanical traction.
Okay.
Are you okay with trying that today?
Yeah, that's fine.
Okay, perfect. So we'll get you set up in it, and now get you set up on this table, and we'll try it out, and we'll just try pretty light today and see how you respond to that.
Okay.
Okay, so we're gonna set Gloria up on the mechanical traction for her lumbar spine. So first we're gonna put this on, and we're gonna put this around your back, and we'll put this around here, and we just wanna make sure it's over the bottom of her rib cage here. Just make sure we're not pulling anything off. Good. I think this clicks into, yeah. I'll just click in here. Okay. And then we'll put this bottom piece on. And this we're gonna make sure it goes over her hips. Sorry, I'm gonna reach you. Just making sure it's above those hip bones. Like that. And then we'll get her set up on the table. Okay, so now we're gonna set this up. So since we're doing lumbar, we're gonna do lumbar. And we're gonna do a posterior protocol. So we'll just hit manual here. And then the pounds will set up to 50% of So we have time in 15 minutes. And then the pounds will be 50% of their body weight. And then we'll hook them up to here and to their loop over here. And then we'll just hit start. And I gave the patient a kill switch. All right, I just started it, so it should start pulling you just slightly. If anything is too painful or you feel any pain, this switch will kill it.
Okay.
And we'll stop it, and we'll slowly bring you back down, so it's not like a big wham.
Okay, great.
You. But if you need anything, just give me a holler, okay?
Okay, thanks.
Perfect. Okay, so it has been 15 minutes, so I'll stop that for you, and we'll unhook you.
Okay.
And everything.
I clicked it.
Oh, it stopped anyways. Okay, I'm just gonna turn it off. Alright, how did that feel?
It felt kind of nice. Yeah, I think it might help a little bit with some of my pain, so.
Okay, perfect. I'm gonna get here.
Okay.
You don't have to be in here, so I'm going on you. Okay, perfect. So we can keep trying this, and we'll do some exercises along with this, and hopefully that will get rid of some of that pain you're feeling.
Okay, great.
Does that sound good?
Yeah.
Okay.